want to introduce Kris Pearce. So Kris is a SWAN mum, and she wears many hats as an amazing consumer health advocate and knows a lot about genetic epilepsy, far more than I do. So she's going to give the parent perspective of supporting her child through the hospital system and the maze of supports that are out there. So over to you, Kris. Thank you.
Well, thank you. I just want to premise it by saying I'm definitely not an expert in either epilepsy or genetic epilepsy. I'm certainly an expert in my son and his presentation and his gene. Even then, I'm not an expert because it's very rare. But so it's really just my experience and some of my learnings that I'm going to share. Open to questions, so just feel free to jump in and ask questions as we go. And we'll get started. I apologize, I haven't used this forum before, so we'll see how we go.
Okay. Would you like everyone to mute themselves unless they're asking a question?
Yeah, that's probably easier. Yeah, it's probably easier for the recording.
Yeah.
So, as Heather said, so I'll just, this is really just me sharing my experience of epilepsy, and I guess also some learnings and what we've done, and then getting a diagnosis for our son. So this is my beautiful twins, Will and Ella, who are now 13 and no longer children. Will's epilepsy story started when he was 4 days old, and he basically started having apnea seizures. So he would turn blue and all the associated things that came with that. Actually seizures, taken to NICU while they were out that it was actors. He was put on some medication and originally sent home from NICU with the phenomenon where they have with a thought that he has day 4 seizures, day 3 or 4 seizures, and they self-resolve, and the kids go on, have normal life, and it all self-resolves. So with that in mind, they took him off medication, and he started having seizures within a couple of seconds, and pretty much the rest of that year, so it's about 3 months to 12 months, at the children's having seizures. He would have one seizure, sleep, wake up, have a seizure, wake up, have a seizure, and that pretty much cycled for a number of months. Within that time, you know, we were as parents, you know, he's just got epilepsy, you need to accept it and move on. But even within that 3 months, he'd started to smile and progressions. And so we were like, this kid's gone back to being a flaccid baby. He's got no control, which made them started looking into it a little bit further. But his EEG just kept deteriorating, and so they felt that he had a degenerative neurodegenerative condition called ALPS, which used to get worse and really continued to pass away within a couple of years. And that was a diagnosis we were sent home with when he was about 12 months old. Expecting him to, and we're coming to grips with what that meant as parents, while trying to parent his twin sister and give her some sort of normalcy. But then he started to smile, and we would take him to neurologists and go, yeah, but he's smiling, you know, he wouldn't be smiling. And the neurologist would say to us, oh, but you know, you can smile when you have, it was a little bit more, it could be a seizure. And at that time we decided that we'd find something more positive, because we felt that there was other sign towards some progressions, some developmental progressions, not huge, but there. And we spent a lot of time with neurologists, development paediatricians, in his early years, and whilst he was still having quite catastrophic seizures, there were small growths in his development, and the seizures were getting more controlled. However, we did cycle through pretty much every anti-epileptic drug that was suitable for him, and none of them controlled his seizures. His immune system was also compromised. So any cold, any virus he got, he ended up in hospital fighting for his life. So again, they were looking at what was it that was causing all these problems, because it was clear it wasn't just epilepsy, but epilepsy was part of a bigger picture. So he had bone marrows, he had muscle. We sort of drew the line at having a brain biopsy when he was little, and I guess over time the seizures started to get control of the seizures. As he got older, they down. What he would have, and which I'll go on to in coming slides, is he would have quite big seizures, but not that often. And then at 14 years, as part of a research project, he was diagnosed with a rare genetic condition called SCN2A. And SCN2A is a sodium channel, a problem at the sodium channel, and he has an overexcitement of the sodium channel, which means that that overwhelms in the brain, or he has sites for cell, and therefore he had the seizures, which he still has a very, we call it, it's not normal by any stretch of the imagination, but he doesn't have overt and typically see. However, he's still on 2 anti-epileptic drugs. So that's a sort of a background picture of Will. So with Will, well, epilepsy, as you probably all know, is the tendency to have recurrent seizures, generally not caused by fever, and that's usually caused, well, it is caused by a disruption to the normal electrical activity of the brain, and they can come in varying types, severity and intensity, and can manifest in changes in consciousness, movement, sensation and behaviour. And our experience with seizures is we pretty much saw every type. And I remember when Will was in hospital that first 12 months, there was a lady who had a child who's probably not dissimilar to Will now, a teenager, and I just remember meeting her in the parents' room and her saying, just every time she presents with a seizure, it's different, and we don't know because it's changed. And I remember that's what happened with Will. Like, he would present with a type of seizure, it was very obvious. Then it could be a movement disorder, it could be a different type of seizure. We think at the minute he's probably having some myoclonic jerks, but he's not had them before, so it wasn't really until we went to the neurologist and she said, oh, does he do this? And I'm like, yeah, he does. So, you're always uncovering something in our experience that looks something different. So he's had focal seizures, he has generalized seizures where he had the big tonic-clonic when he was a lot younger. We think he's having the myoclonic jerks, and he's definitely had absences pretty much throughout his whole life. What he used to do when he was younger, when he was having the sort of larger seizures, is that we would find that he would be unwell, and my husband and I would say to each other, something's coming, and it could take weeks, but he would build up. It was like this crescendo to a seizure where he would build up, become more and more unwell, and then he would have this catastrophic seizure, and they were life-threatening. I remember we were down near where you are, Heather. We were down in Tukaruk, and he had a seizure. He hadn't had one for a long time. We called the ambulance. They gave him emergency medication. He basically flatlined in the ambulance, so they had to call a mica, and standing on that, what is it, Nepean Highway or whatever down there, while the mica came to take him to Frankston Hospital. And that's what it was like. Every time he had a big seizure, it was a life-threatening seizure. Whereas over time, that sort of dissipated a little bit. He wasn't having as severe. Those seizures could go for 45 minutes. without emergency medication helping him. I guess the point of saying that is really that he is, I think if you've got a child with epilepsy, don't always expect the seizures to be the same. They can be different every time they present, and my advice as a parent, I wouldn't be afraid to talk to the doctors about it. Film it, video it, and I always, once we were able to video, like I recently, as I said, Will's 18, and we recently saw Professor Sheffer for the first time because Will transitioned out of paediatric care, and she asked me for the videos right throughout his life. So we were able to go back probably to when he was maybe 4 or 5 and send some of the more prominent seizures and the different types of seizures that he had. So it's really important, I think, to keep a diary, a written diary, but also a video diary of how they change or how they're presenting or anything that you're worried about. Because the other thing for us was Will would have a presentation with his arms or his legs, and he wouldn't lose consciousness. And we were 100% sure that they were seizures. But it wasn't until Will got his diagnosis at 14 that we understood that movement disorders was part of the SCN2A diagnosis, and a lot of the stuff that he was having was movement disorders and could have been managed, potentially managed differently with different medications. No less disruptive to his world, but just managed differently in different medications. So I think it's really important to video it, but also let your doctors know, and potentially an EEG to rule out whether it's a seizure or something else. So just to, because not all causes of epilepsy are known, but some of the broad categories that cause seizures, like for my son, is genetic, and there's an underlying predisposition to having seizures. However, not all genetic seizures, genetic syndromes or causes have a family history. So, for example, Will's is a de novo, so it's a random presentation that he hasn't got from David or I. We both had to have genetic testing to rule that out or rule it in, or to find out what the result was. And that's been an important part of the picture and finding out what's caused Will's and what Will's problems and what we can do. Other reasons or other causes are immune. So it's from an immune disorder, which can cause seizures, from an infection, metabolic reasons, which they were looking at for Will early on, and structural. Will didn't have any structural changes or abnormalities in his brain, although he did have, because he was so sick when he was little, he did have a few MRIs. He probably had one every other year just to make sure that they hadn't missed something as his brain grew. And of course, there's unknown causes. There's a lot of people with epilepsy who don't know the cause. And this figure I got from the Epilepsy Foundation, 6 out of 10 will have no known cause of epilepsy, or I think that's changing as genetic testing is evolving for our children. So some of the common comorbidities that we find with epilepsy are learning difficulties, behavioural problems, anxiety, depression, attention difficulties, autism, sleep disorders, and social difficulties. And if I can go into an example with Will with his SCN2A, he probably has, luckily he doesn't have sleep issues, that's a bonus for us, but probably all of the others. And part of it is part of his syndrome, and then the other part is probably because of the seizure activity that he's had constantly his whole life. And I've put in a picture there because Will at 18 is functionally non-verbal, and even though he now can use text to talk or a device to communicate, way back when he was a little tacker, he used PECS, and that's his book with all his words and pictures in there, and that's how he used to communicate and ask for things. But he had sleep issues when he was younger. Behaviourally, it's probably his behaviour issues are probably related to his autism or autistic tendencies, and he just likes routine and schedules. So I'm sure, like you can all imagine and are experiencing, is that he's not coping super well at the minute, and he's doing okay, but he misses the regularity of his week, and with us trying to work and all that sort of stuff, he's coming unravelled a little bit. So there's some of the common morbidities that come with epilepsy, and I'll just keep going and then we can just have a general chat at the end. It's probably easier. So I just want to talk a little bit about what's in a diagnosis and how we get it. I guess getting a general diagnosis of epilepsy comes from keeping a diary of what's going on with your child, whether it's a visual and or a written diary. And then your neurologist or paediatrician would order an EEG, which gives a record of the electrical activity of your brain. And also they might do blood investigations. And as I mentioned before, they might do some imaging, mainly an MRI, and more so in the last few years, genetic testing, to find out what the cause is if they're able to. And there's a couple of things that they can diagnose by the type of epilepsy presentation, and that is their syndrome. So you've got Lennox-Gastaut syndrome, West syndrome. So these are some of the syndromes that present in a certain way, or benign epilepsy of infancy. There's a whole range of different syndromes. And whilst Will has a genetic diagnosis of SCN2A, he also has a syndrome diagnosis as well, as should most children. And it's how the epilepsy presents within the genetic diagnosis. So a family we know, their child has a genetic diagnosis of SYNGAP, but they also have the Lennox-Gastaut syndrome. That's the type of epilepsy that they have in the genetic. So I guess the question is then, how far should you push, or how hard should you push, or how continuously should you push to get a diagnosis? I think it's really important to work with your child's neurologist to find out if there is a cause, and also if to do genetic testing. There are pros and cons to doing genetic testing, and we sat in did some group some forums last year where we talked. There's a group of us, there was genetic professionals and parents and people who work in this space, around the pros and cons of genetic testing and what would help you choose or not choose to get genetic testing. And to be honest, there are pros and cons to both, and I think it's a really individual decision, and that you should definitely have that conversation to get the test before you get the testing done. And some of the things that if you might do the genetic testing, you might not get an answer. And what does that mean? And how often then do you have retesting of your genetic, the genetic information? So I think at the minute there's about 600, and that might be wrong, so don't quote me. There's hundreds of different types of genetic epilepsy on the epilepsy panel. However, that has grown exponentially over the last 12 months. So in another 12 months, you don't know how many more genetic causes of genetic epilepsy there will be. So it's worthwhile revisiting. I think at the minute they recommend every 2 years for retesting. It gives the scientists time to discover new causes and corroborate what they're finding. The other reason with genetic testing, or you might get, is a variant of unknown significance. So one of our beautiful families was given
I can't hear anything.
Pathogenic. And so now that it was sit in this space where is it actually the cause of their child's condition, and can they trials and that. So I think trial and all that, it's really important.
Sorry, Kris, it keeps cutting out. And you keep freezing. I can't hear you. Just bear with us. I'm just going to.
Hello.
Hi.
Did I freeze or did you?
No, you're frozen.
Everyone's frozen on my screen. You all look so pretty.
We're all here. You're frozen. I know I've lost you completely, your face and your presentation. Just bear with us. I think next time I'll go with Zoom, not GoToMeetings when I subscribe.
So can you hear me?
I can hear you, but I can't see your presentation. Can see you now. Can't see your presentation though. Looks like you're frozen or you're concentrating hard.
Sorry, guys. It's all here on my end, but I don't know.
I can see you now. I can see your presentation now, and you. I think you're back on. I think it just glitched out for a bit.
Okay.
Yep, you're back now. Thank you.
Oh, sorry. That's where we're at, wasn't it? Can you hear me?
Sorry, you'd shown the picture of Will with his. Keep going.
Yep, I can hear too. And we're up to the last bit. I think you were just talking about another family that you knew of.
Oh, yeah. So I think I might just, I'll have my presentation. I think that just going between the two, I might be losing a bit of.
Maybe. You're good now.
So can you see the presentation now?
Yep, you're good now.
Okay. All right. Yeah, so I was just saying that, so two things was that, one of our SCN2A families was given the gene SCN2A showed up, but whether it was pathogenic or not was unknown. So it was giving variant of unknown significance because it was the first variant of SCN2A. There's no other one to corroborate it. So the only way to change that is by seeing a specialist or someone that can say that these symptoms fit into the SCN2A basket. So genetic testing is not the be-all and end-all, whilst it does give you some advantages. I think I was going on to say that with SCN2A, because in Will's case, it's the the sodium channel is excited. So the type of anti-epileptic drugs that should be used are sodium channel blockers. And it's really, really important when the kids are younger. So getting a diagnosis when the kids are born, and most kids are now given genetic testing if they present like Will did. They're put onto sodium channel blockers and they're having much better outcomes, because we don't know whether a lot of Will's problems were caused due to brain damage because he had so many seizures that was so catastrophic, or whether it's just the SCN2A, and we will never know. So there are certainly advantages, but I would also say, you know, make sure you understand all the ins and outs of having genetic testing. So what's the impact of epilepsy? I just wanted to, and this is really one of my passions, is highlighting that epilepsy is often not just epilepsy. Now, of course, kids who have syndromes like Will, you'll find that they have a whole gamut of issues. But the impact of epilepsy on our children means that they have a chronic illness, and it can have a big impact on their education, their overall health, and their social and emotional health. And those psychological and social impacts of epilepsy are as important. And I've written there as the economic burden because I've been trying to work with the Epilepsy Foundation and others about the impact, more so of genetic epilepsy, because that's where our family sits. And when you have these children that need all this help from the health sector, but also the disability sector, that we're really not getting like-for-like funding from the government in either sector. And it's really just learning how we advocate. So the economic burden is not to say our children are a burden. It's more about that this is a really big deal, and we need to raise awareness in order for our kids and our family members to get the services and care that they need. So it's just, I guess, a big picture, so we understand that epilepsy is not just having seizures, and I'm sure if you've got a child with epilepsy, you'll more than understand that. About 2 weeks ago, or maybe it was only a week ago, there was a paper released.
Sorry to cut in, Heather, I've got to go. Hunter's ruptured his spleen. He's going in for emergency surgery now.
Good luck.
It's been fascinating, guys. I hope I can watch it again later.
Yeah.
Take care.
Okay, bye.
Bye.
Yeah, about just recently, 2 of our Melbourne neurologists were involved in a paper. So Professor Ingrid Scheffer and Dr. Catherine Howe, and it's called about the spillover impact of having a child with a rare genetic condition. And they, luckily for people with rare epilepsy, that was included in this paper, and it talks about the impact of having a child with epilepsy, rare epilepsy, and the impact on parents and the health impact on parents, and that our health quality of life is not the same as our peers. I'm sure we could all sit here and nod and totally agree with that. I know that I've certainly suffered both physical and mental challenges as having a child with a rare genetic condition, and this paper basically supported that. And again, it's part of the bigger picture for us to continue to advocate for better services and greater funding for our families and better health services. But it also supports the government funding genetic testing. It also supports them funding precision medicines as well, so that we can reduce the impact of the person who's having the epilepsy if there's precision medicines that come up that can help. So that is all good news for us, as we're all heading in the right direction to get better help for our kids. So just a bit of a personal background. So since Will was diagnosed 4 years ago now, over 4 years, we started up SCN2A Australia, and so we've set up a website, we've got our social medias, We do a podcast, which is not all SCN2A related. There are some general genetic epilepsies. There's also information about natural history studies, about caring role. We recently did one with Heather. There's a few general podcasts there, which as parents of epilepsy children, you might find interesting. We've also done one with a geneticist, which has actually been our most popular one. She talked through all the different genetic testing, what it means, and so there's some podcasts there that might be interesting. And just to give you a bit of hope, I guess, as well, is that SCN2A is currently working through a natural history study, which is, it's imperative when you've got a rare disease to have a natural history study, and we're lucky that it's been run out from the Royal Children's. And so we've been very supportive of that and rallying patients around the world to, if they want to be involved in this, within 12 months, I think we're almost halfway to our 200 patients, which is fantastic. It's also necessarily to understand the condition. So the way we'll present it will be different to the next person with SCN2A, and it starts to see patterns and the different presentations, the different challenges that health challenges. So like some might have movement disorders. Will doesn't have eating challenges. Now a lot of our kids have a peg fed. And so it's really gathering all that information, which helps not only understand the disease, but it also helps design clinical trials. And hopefully next year, we're moving on to a disease-altering clinical trial, an ASO, which again is born from science in Melbourne, from the Florey Institute with Professor Steve Petru. And he's been working with some companies to build that treatment. It's currently going through safety, and hopefully that will continue to progress and show to be positive and start clinical trials next year. Is just for a small cohort of the SCN2A population, the ones that have, like Will, that have got the excited sodium channel. But it's very exciting. Many other gene groups are envious that we are that far along, but it's the advantage of having a diagnosis and the ability to connect and also support research in your own child's gene. The other group that we work closely with, we founded Genetic Epilepsy Team, encouraged by Professor Sheffer. There's 3 families that have driven that, a family with SYNGAP and a family with KCNQ2, and we run an annual conference in Melbourne generally, but we're considering options. This year it was going to be over 2 days, but we've changed it to a half day on May the 30th, which will be a virtual conference. And the topics are general, they're not on a specific gene. So if you're interested and want to know more about genetic epilepsy, we'd love for you to join us. It will be taped. You will be able to ask questions on the day. So the link is there, and we can post it wherever we post this when it's edited. The other thing we've started doing is advocacy for families. I guess I sort of touched on that a little bit through the talk. Last year, towards the end of the year, we had a roundtable where we had parents with genetic epilepsy, we had genetic counsellors, we had neurologists, we had the Epilepsy Foundation, we had advocates, we had epilepsy nurses all sitting in the one room, and we worked through what the challenges were that families faced. That's now been written up in a white paper, which then is going to turn into a questionnaire for families on genetic epilepsy, with the whole outcome, again, to support the needs of our families, because we can go to government or to the hospital and say we need an epilepsy nurse or we need this, but we really need that information to support it. So Genetic Getter is doing some of that advocacy, working with the Epilepsy Foundation and also other groups around Australia to drive that agenda forward. Just some references. I don't really need to read through those, but where I got some of my information from. And then podcasts and webinars. As I mentioned before, our SCN2A podcast, you can subscribe or just jump in and listen to the ones that are of interest to you. Genetic Epilepsy. So we have all our past conference videos on our website, so you can go and click on there and listen to any of the presentations that we've had in the past. Each year we actually do 5 minutes with, so there's a 5 minutes with parents, carers. We'll actually do one the first year with his device, his communication device, and they're actually quite emotional. So if you do sit down to watch any, grab a tissue. And we're going to do those again this year on our virtual, but they will be, you know, we'll get them to video them and send them to us, and we'll pop them up during the morning. And then another group that we've just connected with is development. Actually, I put that down wrong. Sorry, it's development epileptic encephalopathies. So it's DEE, not DDE. And they're a group in America who are working towards developing resources for families with development and epileptic encephalopathies. And that is my talk for now.